Good morning. I'll let you two begin the honors. Thank you. Does anybody happen to need a pen, just in case? Any pens needed? Yes? You should have everything you need in the handout as far as, covering what we're going to talk about. But once in a while, somebody comes up with a question to ask their doctor or wants to write something down I might talk about that's not on the handout. So just in case, you're welcome. Sure. You're welcome. Fresh out of the Humana storage. And you can all keep them. You're welcome. Thank you. Good with pens? Oh, look at that. Just enough. 1, 2. And I have more if anyone else needs any. You're welcome. All good back here? Okay. Good. While I'm getting my clicker set up, I'm going to ask you a question. I want to see if you can answer it without looking at your handout. Can anyone tell me the 2 most common types of arthritis without looking at the handout? Very good. That doesn't usually happen right off the bat like that. Oh, man. Okay, that's a lot. Can anyone tell me the difference between the 2? The main difference? That's true. Say autoimmune. That's right. And I don't know why I never have working clickers. It's so weird. That's okay. I can come back. Actually, that might be why. I'll just come back and manually do this. Okay. Anyway, so the difference is, correct. The second one, rheumatoid, is an autoimmune source of arthritis, whereas the first one, osteoarthritis, is actually just a plain old wear and tear of the cartilage. So rheumatoid, we're going to go over the differences, the main differences between the 2. But yes, I agree. Whoever said rheumatoid is worse, that's what I hear, and that's what you read, because other symptoms come with it besides just the pain and the swelling, because it's your immune system overreacting, right? You get fevers sometimes, achy, real tired, stuff like that. So not so fun to deal with. So we're going to talk about a few different things. Let me pull up my agenda here. I don't know why that never works. Could be my port.
Okay. There's a reason why I'm here always.
Yeah, because I always have problems with stuff. Always. I can buy a brand new clicker and it won't work. It's definitely a common denominator problem. It's me. Me and technology just don't go together. I know there's got to be someone in here that can identify with that. So these are the things we're going to talk about. We're going to just kind of go over the basics of arthritis, similar to what we just did, like the differences between the osteo and the rheumatoid. I probably don't have to tell you guys signs and symptoms, because I'm guessing if you're in this room for the class, you probably are wanting to learn about arthritis because you have it. But sometimes people attend classes to learn for other people that they, know and love. So that could be the case too. We're going to go over how joint pain is treated. There's some conventional ways that doctors are choosing to treat it. Of course, we're going to talk about medications, we're going to talk about surgeries, and we're going to talk about some non-conventional, more natural ways to treat it. And then if you know me, we're always going to talk about lifestyle changes too that will help with arthritis pain. So that being said, I want to make sure you guys know that, especially since this is a smaller group, please feel free to share stories, share experiences, tips that you might have that we might not know about or might not be in this presentation. And always feel free to ask questions. You do not have to wait till the end of the presentation, okay? If it's on your mind, ask it. I also want to make sure you all know also that I am not a doctor. My name's Jill Davis, and I'm a health educator with Humana. So my background before going to grad school was in the fitness industry, and I was a personal trainer and a fitness director for about 20 years. And then when I got into my early 40s, I figured I probably can't do this job for a lot longer because as you get older, you don't want to have to pick up heavy weights or spot people who are stronger than you and all of that wear and tear. So I went to grad school and got my master's degree, and ever since then I've been working with Humana as a health educator. So that's where I come from. That being said, a lot of times people do ask me questions like I'm a doctor, and I understand why. But if there's something you have questions about regarding like medications or something like clinical, please write it down so you don't forget to ask your doctor about it, or pharmacists, or whoever you have that's a trusted resource. Registered dietitians are usually good too. So everybody has a different trusted person. So just write it down so you don't forget to ask. So you're right, the two most common types of arthritis, osteo and rheumatoid. Believe it or not, there's over 100 types of arthritis. I actually didn't know there were that many, but there are. And there's also over 100 types of autoimmune conditions. Doesn't it seem like a new name of an autoimmune condition pops up like every day? Have you noticed that? Like, oh, I've never heard of that one. That must be a new one. But we're going to get into autoimmune just briefly to explain how rheumatoid arthritis affects the body. But this is osteoarthritis. It's pretty basic. It happens when the cartilage wears away. That's exactly how it works. Usually it's a wear and tear situation, which is why it happens when we get older. Because if you use, let's say, the same bicycle every day for 60 years, and you're driving it up hills, carrying a backpack, whatever, parts on it are going to wear out, right? So just like a car, just like a wheelbarrow, we are going to wear down as we use joints more often. And of course, the pain starts to develop when that cartilage wears down to the point where the bones start rubbing together. Then we get the swelling and the stiffness and all of that stuff. And the most fun is when the cartilage is completely gone and you have bone on bone, and then you wait a little longer and it starts to lock up. That's when the real fun starts, right? So we're going to kind of go over all of that in just a little while. Oops. Okay, so this is the rheumatoid. So autoimmune conditions, I want to make sure you all know they kind of have the same foundation. No matter what part of your body your system, your immune system attacks, they all have the same foundation, and it's an overreacting immune system. So the last thing you want to do if you have an autoimmune condition is power up your immune system. So that means generally you don't want to give it a boost in any way. Like you don't want to add vitamin C. You don't want to add things that make it stronger. You want to do things that balance your immune system. And I bring it up in probably every class I teach because it works for just about everything, and that's vitamin D3 If your doctor is not already checking your levels of vitamin D3 in your blood, make sure you ask them to, okay? Because if you have an autoimmune condition, your doctor already checks it, I'm sure. But just in case, I would always ask. You want it to be somewhere between 50 and 70. Just never want it to get to 100 or higher, because that's when it can become toxic. So that's why you want your doctor to check your blood levels and not just buy vitamin D from the drugstore and start taking it without knowing how much you're supposed to be taking. So the key again for autoimmune is balancing out the immune system, not making it overreact. And unfortunately, with rheumatoid arthritis, your immune system attacks your joints. It thinks there's a virus or a threat in the joints, and that's where it's attacking. So that's where you see that image to the right, where the bone starts eroding, cartilage loss, and then of course we're going to start seeing some swelling, and the pain will start not too long after that. Usually this begins at a younger age than osteoarthritis because it's not a wear and tear, so it doesn't take that amount of time for the cartilage to break down because the body's taking care of that for you, right? And it can go into remission too. So you might notice if somebody has it or another autoimmune condition, if they start eating really bad, like eating a lot of fast food, eating a lot of like inflammatory foods, you're going to notice, well, actually in both cases of arthritis, inflammation gets worse. And I know there's an inflammation group in here, and I'm glad you're all here because this is definitely an inflammatory disease that can be made better by doing things that help calm inflammation. Questions so far? Go ahead, Jackie. Usually it's diagnosed by a doctor, and you'll have other symptoms because you'll feel more fatigue, sometimes feverish, sometimes like almost like you have the flu, because it's like you have a virus. The other thing, which is a big difference, is like with regular osteoarthritis, you can get it in just one knee or just one hip. With rheumatoid, it's on both sides. So you'll never have just one knee with arthritis if you have rheumatoid. It's going to affect both the same. Yes, good question. Jackie asked how you know which one you have. Any more questions? Okay. So I heard somebody earlier reading this in the handout and saying, check, 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 check. I have all of those. So getting older, of course, wear and tear. Being a woman, especially after age 50, it's a lot more common because what else tends to happen around age 50 and after? Menopause, yep. So that estrogen coming down kind of pulls out some of those protective barriers. So we're at higher risk for heart disease, higher risk for osteoporosis, higher risk for arthritis. Family history, of course, genetics are always fun, right? I used to thank my mom for her genetics that she passed down for heart disease. And then, but that means like just because even if both parents had arthritis, it does not mean you will get it. It just means you're at higher risk for it. Just not a guarantee that you'll get it. Being overweight always puts you at higher risk because of that wear and tear again on your joints, right? So if you lose just 10 pounds, that's actually 40 pounds of pressure off your joints. So every pound you lose is 4 pounds of pressure off the joints. So that's why when you hear doctors, sometimes they have a patient that needs like a knee replacement or a hip replacement, they'll usually have them lose a certain amount of weight first because they don't want that new joint to wear out as fast. So they always recommend somebody gets to a healthy weight. Overuse or repeated movements. So, I mean, that kind of makes sense. Mine is starting from being a personal trainer because countless numbers of times doing squats, doing lunges, demonstrating jumping exercises without warming up. So I'm starting to get the crunching noises, which I know is the beginning stages. No pain yet, but the crunching noises have started. History of joint injury or surgery also puts you at higher risk. So this, again, is just a list that means you're at higher risk, does not mean you're guaranteed to get arthritis. I probably don't have to tell anyone in this room what the symptoms are, but you'll hear the noises like Rice Krispies sometimes, cracking, crunching, sometimes with pain, sometimes without. Swelling, definitely a possibility. A lot of stiffness, especially if you've been sitting for a long period of time. Anyone else have symptoms that they want to share that might not be on this list so we know what to look for? Shoulder pain, yep. Sometimes trouble sleeping can be a big issue. And then again, if you have rheumatoid arthritis, you could find that you get feverish or really achy and fatigued on top of that. Because remember, your body thinks you have a virus, so the immune system acting out is going to feel like you have a virus, right? Okay, so now we're going to start some of these treatment options that are available these days. Analgesic, that's a pain reliever, but it's funny because it doesn't work on the joint itself. It works on the brain. So it's usually a type of cream, like Voltaren, things like that, that you put on the joint, but the way it works is it sends a signal to the brain that there's no pain in that area. So it's not really doing much for the joint itself, it's sending the signal to the brain. Does anyone know why it works on the brain? Does anyone know where pain is processed? In the brain. Yeah, so you probably heard of people who are missing a limb and they get something called phantom pain. You don't really necessarily need the limb to get pain, but you need your brain, right? So wherever your pain is, it's definitely real, but both pain, stress, and emotions get processed in the same part of the brain. So remember what I just said, because we're going to come back to that when we talk about some other treatment options. So if your pain is processed in the same part of the brain that processes stress and anxiety, if you think about it, when you're stressed out more or anxious, your pain might be worse. And of course, when your pain is worse, you might be more stressed out or anxious. Okay, so we're going to come back to that, and I'll share some things that you can do to help calm that down. Corticosteroids, that's whenever you have a friend that says they got a shot. Usually it's an anti-inflammatory shot that they get directly into the joint to help with the inflammation, and that works through the immune system. Non-steroidal anti-inflammatory drugs, you probably hear them on commercials. They're called NSAIDs. So that would be like Advil, ibuprofen, naproxen, things like that. And they block the production of a pain-causing chemical, also working on the brain. And then you have all the other drugs, like there's an antidepressant, which kind of makes sense, right? If you're anxious and you have more pain, if that antidepressant works on the anxiety, that can help with the chronic pain, right? And then the anti-seizure drugs sometimes will just work on the nerve endings. So that can help with pain too. Then you have counter irritants, and those are usually also creams or gels or roll-ons. And those have capsaicin, which is a form of, or it's an ingredient in the cayenne pepper, and then menthol. So BioFreeze, you've probably seen that one, because I think it's everywhere. PT offices, chiropractors have it, massage therapists usually have it, and I think it's even at CVS now. But those work on the nerve endings, and again, tell your brain that there's no pain, because then you're thinking about how cool your arm has become or how warm it's become, and you're forgetting about the pain. I'd say that was more an analgesic, CBD. Yeah, because it blocks the brain from recognizing the pain. Good question. Pam asked if CBD was on this list and which one it was. Another question, I thought. Oh, go ahead. Yes. Yep. Yes. Absolutely. Yeah. Yes. And that, again, is why I always stress anything you're considering doing, always run it by your doctor. Because even something like that Voltaren that just works on your skin, if you're on a blood thinner, that can cause serious issues. So if there's anything that you're thinking about changing, even if it's something simple like taking turmeric, you need to run it by your doctor, especially if you're on any types of medications or you have a medical condition, okay? Because you never know, even natural supplements can interfere with medications. You might not be able to take them at the same time, might not be able to take them at all. When I taught this class at a primary care office in Raleigh, somebody shared that her daughter took turmeric and wasn't supposed to, and for some reason or another, it caused a reaction because of a medication she was taking. Same thing with that Voltaren, because it's an anti-inflammatory, but it thinned this person's blood, and she started getting nosebleeds. So just because you put something on your skin does not mean it's not being absorbed into your body, too. So keep that in mind. Anything new you try, run it by your doctor or pharmacist, because I know they're trained a lot in supplements too. Yeah, it's not an NSAID. I'd say it would be the analgesic. Yep, not anti-inflammatory, but it blocks the pain. But again, even with the Advils and the Tylenols, run it by the doctor if it's something new that you want to do. Any more questions on these before I move on? Okay. And then, of course, this is my favorite, exercise. So I'm sure you can imagine in 20 years of being a personal trainer and teaching Silver Sneakers classes, I had a big variety of clients all the way from 20-year-olds through my oldest one was 90 years old. And it's amazing what people are able to do when they focus, little by little on consistency. I used to brag about my 80-plus-year-olds. I used to train them all in a group. And one day I decided to have a plank competition. You guys know what planks are? Where you actually hold on your forearms and your toes and your core does all the work and you hold that position on the floor. An 82-year-old beat everybody with 4-minute hold. 4 minutes she held that position on the floor. It was probably the most amazing thing I've seen in my career. But I just want to share that because that's possible, not because she went from the couch to being able to do that, but because of consistency. I think she worked with me for like 3 years. Over time, she just kept getting stronger and was able to do that. So it does not matter how old you are. It's never too late to start, but the key is to start in a safe way and go little by little and work with a professional. Go ahead. Good. Mm. Yeah, that's a great question. Yes. She actually had rheumatoid arthritis. But the thing is, she wasn't walking. She was doing strength training. Big difference. So I'll explain that. I'm glad. Yeah, I'm glad you asked. So walking is an amazing exercise. There is zero question. In fact, all of the health organizations recommend 150 minutes a week of cardiovascular activity. Strength training is important because after age 30-ish, and then it gets even worse after menopause, we start losing our muscle mass at an alarming rate. So if we think about it, what's holding our bones up? What's supporting our joints if we don't have enough muscle mass? Nothing, really, right? So if you think about it, the stronger our muscles are, the stronger our tendons and ligaments are, because they actually get thicker when you do strength training. It works as almost like a bubble wrap. I always use that analogy because if you were to fall or get in a car accident or something like that, that will protect your bones and muscle. It's also what absorbs the impact when you walk. So when you walk and you don't have a lot of muscle mass, the joints get the impact. When you walk and you do have the muscles supporting the joints, the muscle supports the impact. So, and I'm not going to say go out and start doing squats, right? You need to hire a professional to work with you. If you have arthritis, you don't want to just go start doing random things to build muscle. Physical therapists, probably the best place to start. And they're not just if you're post-surgery or having pain. You can actually have your doctor write a prescription for a physical therapist who can take you through a full body strength training routine and assign it to you to do on your own once you know how to do everything correctly. So yes, big difference between cardiovascular exercise and strength training. There's also a lot of research. I know I have a lot of researchers in here, which I love. There's a lot more research coming out on leg strength being correlated to brain health. So and I can't remember the organization that put this research out, but you'll find it if you look on the internet. But they were saying the stronger people's legs were, the better their brain health was, the less chance of having cognitive decline, or less risk of having cognitive decline. So building your muscle is huge. And I saw that as a trainer a lot too, when people would just come into the gym to try to lose weight, and they just do the treadmill all the time, right? And reduce calories, but without that muscle, metabolism also goes down. So we want to make sure we maintain and or build muscle, and you're never too old to build muscle, ever. Excellent question. Thank you for bringing that up. Any other questions about activity, physical activity? Okay. So also a reminder though, talk to your doctor before you just start exercising on your own unless you've been doing it regularly. If you're going to start something new, just make sure they know, ask what your limitations are, and maybe have them write a prescription. And I'll say too, I know I was a personal trainer, but just because somebody has a personal training certificate does not make them a good trainer. So unfortunately, once I retired, my clients had to go find other trainers, right? And I cannot tell you the feedback I was getting. Horrible. Like one of them got her shoulder injured. She has to have surgery. Another one is having constant knee pain. So you want to find somebody who is experienced, and you might even want to ask your physical therapist for a recommendation, because you want somebody who is trained correctly, not just has that piece of paper saying they're certified. The certification does not make you qualified. I'll be the first to tell you that. It's pretty easy to get. And variety is important too, right? So you want to make sure you have flexibility. You want to work on balance. You want to work on cardiovascular too. And a lot of times, there's classes here, right? Somewhere? Yeah, so a lot of times if you have like a silver sneakers class or a group exercise class, they'll work on all of those at once in one class, usually. Do you have silver sneakers here, or is it something else? Similar, okay. If you have certain Medicare plans have free silver sneakers memberships, you guys probably knew that. So You can also go to gyms in the area that have a contract with Silver Sneakers and get a free membership and usually take free classes too. So keep that in mind. Go ahead. High impact? Yeah, yeah. High impact, honestly, I would say nobody in here and myself and Denny, none of us should be doing high impact. High impact just means jumping, jump squats, running, yeah, anything that you're literally coming off the ground and hitting it hard. None of us should be doing any high impacts. It says don't do it every day because of the wear and tear, especially if you have arthritis. But nobody in here should be doing high impact at all, unless you're used to it and you've been doing it all along, right? And your doctor's good with it and all of that. But nobody should be doing it right off the chair, right? Where your body's not used to that. Good. Any other questions about this screen? Okay. So now we're going on to nutrition. So if you happen to be here when I did the Mediterranean diet, it's pretty much the same diet for just about everything because what works for brain health and works for heart health is also anti-inflammatory, and it works for arthritis too. The only thing on this list that you may not know is when it comes to olive oil, the Arthritis Foundation has researched olive oil, and they found that 3 tablespoons of olive oil every day works like an NSAID, works like an anti-inflammatory medication. Doesn't mean that you just start drinking olive oil. Talk to your doctor about it, right? Because it could thin your blood, we don't know. Just mention it to them, but you can drizzle it on a salad, you can roast vegetables in it. It's really good for your brain health too. But then you're probably wondering, what kind of olive oil? Because when you go to the grocery store, there's a whole aisle of olive oil. And it's like, what do I buy, right? But extra virgin olive oil is the highest nutrients and the least processed. And yes, you do want to do organic if you can, because then it has less chemicals in it and all that fun stuff. Somebody told me there's an olive oil store, but I think it's in Raleigh. Can't remember if it was Greensboro or Raleigh. There's one in Mebane? Okay, awesome. Do you know the name of it? Okay. That's cool, though. Olive oil store in Mebane. Anyone else have olive oil brands or anything they like that's not terribly expensive, that's of good quality? I don't know. I haven't, no. Do you know who puts that out? Oh, like an ad type thing? Yeah, yeah. Yeah, that's interesting. Yeah. That's the fun thing about internet, isn't it? Like you can always find stuff both ways, right? Vegetables are good for you, vegetables are not good for you. But as long as you're looking at the sources and it's a reputable source, like if you look at your handout, the very back of your handout is the websites used to make this presentation. So those are some good sources. But I know it's tough out there to know what to trust information-wise and whatnot, and it can get very overwhelming. It can. Go ahead. Awesome. Okay. Okay. Is it in downtown Mebane? Greensboro too. Yeah, field trip. Absolutely. What's the name of it again? The Gourmet Grove. Go ahead. Oh, nothing. I personally would not want to do it. But nothing. Yeah. 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 And I bet the olive oil she was drinking was top notch too. Yeah, it probably tasted pretty decent. Yeah, she's a European. Yeah. Yeah. Yeah, if you can drink it, I say go for it. Yeah. I like it actually I know white bread is not on this presentation, but with some garlic, roasted garlic and olive oil on some bread, that's pretty good. Yeah. So fruits and vegetables, pretty understandable because where else do we get our nutrients from, right? Nuts and seeds, same thing, full of nutrients, full of protein and fiber. Beans, also anti-inflammatory, good for diabetes. If you happen to have diabetes, the darker beans, the better, because they have anthocyanin in them, which is an antioxidant that's been studied to show that it helps reduce blood sugar. And then whole grains, not the white stuff, right? So I say this in pretty much every nutrition class, just stay as close to nature as possible. When you're in question, you want whatever food is as close to its position in nature as it can be, right? So eat better, move more is the phrase. Good question. So shellfish is not as high in omega-3s as like the fattier fishes, but it still has omega-3 in it. And I know there's so much controversy going on with fish. So talk again to your doctor or whoever you trust about fish. Well, some mercury, and now they're saying plastics. I mean, it just makes you crazy. It's like the more you know, it's like, well, what can I eat then, you know? But yeah, it's a tough one. And if you don't like fish, you can talk to your doctor about an omega-3 supplement. If you're going to go the route of a supplement, please do your research on the manufacturer of that supplement because you want to make sure they're testing for contaminants and heavy metals and all of that stuff, and that they're not trying to cut corners because they want it to be buy one, get one free at the drugstore. Right? So all supplements are not created equal. So remember that. Yeah. So I know it's really sad. The more you learn about this stuff, the more stressed you get. It's the truth. So like with wheat, for example, now they're finding that it's more processed in some cases, not all, right? And that the gluten is higher than it used to be. Whole grains now, they're saying there's glyphosates in those, because of the spraying. So it's like, I don't even know what to do at this point, but again, just as close to nature as you can find, and yes, to the variety of whole grains because they all have different nutrients, right? Some are higher in some nutrients than others, some are higher in protein. So the bigger variety you get, the more vast, rainbow of nutrients you get. Great question. Go ahead. Yeah. Wow. Hmm. Yeah. I didn't eat. Actually, I just learned something new from you. Thank you. I didn't know that either. She was saying that Europe grows soft wheat and here they grow hard wheat, and she had a friend that was allergic to the hard wheat. So your answer is just move to Europe. Yeah, because, I mean, that's the truth, too. You can get imported stuff, right? But really, the truth is we allow, I think it's like 10,000 chemical additives into our food supply, and Europe only allows 400. So that's a huge difference. So hopefully that'll be changing. We'll see. But that's a big part of our problem, big time. Yeah. There was a question back here somewhere. Go ahead. Wow. Yeah. Yeah. I know. I know. Right. I have thought about it too. My family is from Portugal, so it would be nice to do that for several reasons. Yeah. Yeah, I know. I know. But it goes bad in a couple days. We just moved this last weekend, and I had some bagels on the counter in my old house, and I realized like those have been sitting there for like a month, and they don't have a speck of mold on them. Like that's when you know, right, that that's not real food. But there's a lot of that going around, right? So it makes it hard. And I'll tell you another story, not to stress you out more. And because I get very stressed when I'm in the grocery store sometimes. It's like I almost wish I didn't know. But even organic in some cases, right? There was a company that makes their own green tea product. And they bought it from they bought a whole shipment in bulk from an organic green tea farmer. But because this manufacturer does the quality testing, they tested the green tea that was organic before they turned it into their product, and it had high amounts of lead. That it was not the farmer's fault. They were following all the rules. They were certified organic, but apparently there was some road, a highway that was close to the farm, and there was like runoff coming from the road into their soil. It's like, so that's why you can't win. So that's why I just say, if you're considering a supplement, because we get enough problems from our food. So if you're considering a supplement, just research the manufacturer, because the last thing we need is to be taking a multivitamin that has a lot of bad things in it and it's making us worse instead of healthier, right? So just make sure we are researching that too. It was funny because I used to see that people researched like the shoes they were wearing and the pocketbooks they were going to use, and they didn't research what was going in their bodies, and it would like blow my mind. I was like, you just take that random supplement from the drugstore and you trust it, but you're spending weeks just researching the shoes you're going to wear. Like, I don't understand. Make that make sense, right? It's just funny if you allow yourself to think about that stuff. So anyway, go ahead. Yeah, it's expensive. Exactly. Exactly. Yeah, it's so true. There's only so much you can control. Um, so with weight loss, I just wanted to point one thing out because we talked about how much pressure you're taking off the joints, but slow and steady wins the race is the point I wanted to make, because right now you guys see it. There's GLP-1 medications being used for rapid weight loss now, and people are wanting to lose weight as fast as possible. So I just want to throw out a warning. If you're trying to lose weight as fast as possible, remember at least half of it is going to be that muscle mass we talked about. That's so important. And that's why you're hearing stories that as soon as people go off those medicines and their appetites come back, they're gaining a lot more fat than they even had the first time, because now their metabolisms are in the toilet. Because the more muscle you have, the faster your metabolism is. The less muscle you have, the slower it is. So like when I would do body compositions on people, you know, remember the term yo-yo dieter, where they'd pick a diet, lose weight, gain it back, lose weight, gain it back. By the time I would get them, I had to bring their metabolisms back, and some of them were like 50% fat. And some were even higher than that, where the scale wouldn't even read it. And that's because they lost so much muscle with that rapid weight loss. So the 1 to 2 pounds a week is a safe weight loss where fat comes off. Fat does not come off any faster, unfortunately, than 1 to 2 pounds a week. So that rapid weight loss people see is not what they want to be losing. So just keep that in mind. I'm not against weight loss medicines at all, but I think you need to be educated and you need to have the right lifestyle changes in place while you're on the medicine so that you're doing it correctly and safely. And that's all I'll say about that. And then these are the alternative therapies that tend to not have any side effects, which I like about these. So massage, obviously muscles can get tight when you're in pain. Acupuncture is something people don't think about, but I've heard some really good testimonials on acupuncture for arthritis pain. I know not everyone in here needs to have Humana, obviously, to come to any of my classes. You can have any insurance plan, but talk to your agent and ask about co-pays for acupuncture, because a lot of plans do cover it with a copay. So just talk to whoever your sales agent is about that. Physical therapy, also excellent for arthritis. The people that I worked with a physical therapist for about 5 years, and he would refer people like after their surgeries and after they finished with him, I would get them and finish their strength training. A lot of times before their joint replacement surgeries, he'd have me work with them so I could build up the muscle so that they recovered faster from their joint replacement. So that also works pre-surgery too, to have a faster recovery. And then TENS unit is that machine that you put electrodes on whatever is in pain, and it sends the electric current to your brain, again, saying there's no pain in that area. So that's how a TENS unit works, right? And then yoga, Tai Chi, and meditation. So remember earlier when I was talking about how pain is processed in the brain? Does anyone here practice meditation at all? Good. So there's a class that we taught called Empowered Relief, and now health educators with Humana are teaching a new one called Living Well with Chronic Pain. And a big part of this class is meditation. So Stanford University did a study on a therapeutic dose of meditation, which was 3 to 4 times a week minimum for at least 10 minutes. Because any less than that consistently long term is like taking a half an Advil for a migraine. And I say that because it has to be in therapeutic dose. So if you're not one that has tried meditation, highly recommend it. The handouts I gave you, you'll see something called the Humana Neighborhood Center, and it's a website. You don't have to be a Humana member to use that website. It's open for everybody. Type in meditation into the search bar, and there's guided meditations from the U.S. Pain Foundation. So that calms the central nervous system so that you're not in that fight or flight that brings your pain level up. But it has to be done consistently and frequently. So it's not like you wait till you're in the most amount of pain and you try the meditation and you say, it doesn't work. It's not going to work that way. You want to do it frequently and regularly and long term. It's called humananeighborhoodcenter.com, and you have it on your flyer with the QR codes Awesome. Thank you. Maybe we can get her more often. That would be awesome. Yeah, that's great. Thank you for mentioning that. That's exactly what I'm talking about. That's great. Any other questions on that? Okay. And if you don't like QR codes, because a lot of people don't like having to scan those from their phone, the website is right over the QR code. Just type that into your browser and you'll find it. And then, of course, surgery sometimes will have to happen no matter what we do, right? We can do all the right things and we still might be faced with surgery. So arthroscopy is like if you've heard a friend say they went in and cleaned out my knee or they scoped my knee, they go in, just kind of clean out the debris or anything maybe hitting that bone that's causing it aggravation. Osteotomy is not as common, but like once in a while, if somebody's bone might not be sitting straight or, you know, there's some kind of a deformity, they'll go in and correct that so that everything wears correctly. It's not just hitting one part of the joint. Resurfacing is if there's sharp areas that are rubbing together, they'll go in and smooth that out, sometimes put a piece of plastic over it so it's not hurting as much. And then, of course, once somebody has tried all of those and all the shots and all the pain meds, sometimes they have to do the joint replacement, right? You kind of know when you're ready for it, I've heard. Most people have put it off. Very often they put it off, but you don't want to get to that point where your joint starts locking up. That's not a fun emergency situation to be in. But all you need is a good osteosurgeon and an even better physical therapist, because I have to say physical therapy following that surgery it's brutal, but it's the most important thing you can do. And you have to do those exercises at home too, right? Because if that scar tissue starts building up, then there's a whole new problem, right? So it is painful because they really work you hard, but it's necessary, right? All right, so for review, I would love it if you guys could tell me something that you learned today that you didn't already know. And if you already knew everything, I'm impressed. I know sometimes there's a lot of researchers in groups, so it's a good thing. That's an, yeah, it's an excellent question. She asked how doctors know which type of arthritis specifically, since there's so many different kinds. A rheumatologist is usually one that a lot of them are the autoimmune. So a rheumatologist is usually the one that figures that out. It's usually a specialist, not a primary care doctor. That's a good question.
Is a rheumatologist a person you would see for osteoarthritis?
Yes. I'm sorry, no, that's for rheumatoid arthritis.
Who would you see for osteo?
An osteo doctor. I can't think of the word. Orthopedic. Thank you so much. Orthopedic doctor. I couldn't get that word for the life of me. Yeah, orthopedist. I moved this past weekend, and I didn't take any work off, and it's like affecting my brain, just so you know. It's like I can't, words are just not coming to me. I think you're doing better than me. Right.
I was impressed with what you talked about with strengthening the legs
Yeah,
and the association with the brain.
yeah. It's amazing. And I verified that. Does anyone here know Dr. Shaw? I know Jackie does. He's a neurologist here in Burlington, and we work together on an Alzheimer's prevention program. Excellent program. If anybody is trying to prevent Alzheimer's, He runs a really good program. But I asked him about that because I never fully trust everything I read, right? But he said that was legitimate, that leg strength is directly related in whatever study it was to brain health.
I often think that walking is strengthening my legs, but I think that it's like on the machines, when you put some of the differences that what
Yeah.
strengthens your legs in addition to walking.
Yeah. So like the specific types of exercises. So there's one very simple one you can do without any weights at all, just body weight. Sit and stand in a chair over and over again. And that can kind of help prevent you from doing it wrong too. Yes, the biggest key for that is, and I'm trying not to step outside of my role as a health educator because I know that stuff, but you don't want your knees to ever come forward over your toes when you're sitting. So you want your hips as far back as you can possibly get them, and if you can lift your toes, even better. That will keep the pressure off your knees more. Yeah. When you're standing from a sitting position? And back down again. Yes. Think about, I know this is gross, but it worked for everybody, like public restroom toilet. Like where you don't want to sit down, but you like hover and you just push your hips as far back as you can. I know it's nasty, but it works for everybody. Like if you just think about that, you'll get in the right position. Yeah. Sorry. Now you're never going to forget that. Yes, definitely. Yep. Go ahead. The standing desk? I think it's always a good idea to not sit or sit as little as possible, but you'll know, just trust your instincts when it's time to sit back down, right? If you're in pain, that's when you stop. You never want to push through pain of any kind unless you're with a professional, like a physical therapist or something. But usually if something hurts, you're not supposed to be doing it. Yeah. Very good, valid question.
I just have a couple of tips for people who might have
Please.
arthritis in their shoulders. I have arthritis from my neck to my toes, not just my shoulders. But like, I'm always looking for ways to make life easier and less painful.
Yeah.
So a few months ago, I bought one of those little bedside rails, and the rails go under the mattress to keep it in
Oh,
place.
yeah, yeah.
And I bought it so I wouldn't fall out of bed.
Good.
But I use it to get up and down. It helps my shoulders get up and down out of bed.
Awesome.
And then I was like bugged by my bedside lamp because the switch is underneath the shade, and it hurt so bad to reach over there and turn it out at night after I was reading.
Right.
So I spent $13 on Amazon, and I bought this little device that you plug your lamp into, and I plugged my 2-bedroom lamps into it, and I have a remote control.
Awesome.
I can turn my lamps on and off by my bed without having to reach over there.
Good.
Through all that.
Yeah,
That has really helped a lot.
share that maybe in your next like anti-inflammatory group. Share that stuff because that makes life easier. With the repetitive motion thing, I used to train a state trooper, and he was a Marine, so he had tremendous wear and tear, right? And he would keep his hat in the back. So it reminded me of it when you said that. And he started getting really bad arthritis in his shoulder, one shoulder. And I was like, well, think of what repetitive motions you do that make that pain happen. He's like, I think it's when I get my hat from the back seat. I was like, just keep it in the front seat. And then he stopped having the pain, you know? It's like anything you can do to make your life easier so you're not having to work through the pain, right? It's worth doing for sure. Yeah. So share those tips with each other. That's a great idea, Pam. Any other questions or anyone want to share anything that they learned that they didn't know before? And otherwise, I'll let you go. Good. Thank you all so much.